in not being able to verbally talk back and forth with the patients. You need to try to read their body language, read their behaviors, and that helps develop multimodal management.
Hello, everyone. Thank you again for joining me for another great episode of VetFolio Voice. In this episode, I was joined by Mary Ellen Goldberg to talk about chronic pain in dogs. Well, we planned to talk about chronic pain in dogs, but we couldn't help but sprinkle some cat information in there too. So, thinking along the lines of pain management, this is an area that's evolved so much. It's left us with more options than ever to help keep pets comfortable throughout their lives. But the availability of more options, more tools, it can also kind of feel like it's hard to keep up. Mary Ellen was wonderful to talk to. She talked through evaluation tools like clinical metrology instruments and client videos, clinical techniques like acupuncture, laser therapy, and TENS units, and of course, medications like NSAIDs and beyond. But perhaps most importantly, we touched on how all of this works best when we approach it as a team. And when there's good communication between the vet, the veterinary technician or nurse, and the pet owner, because I'm sure as many of us out there have experienced, recognizing pain and managing it effectively, that's a team sport. All right, let me tell you about Mary Ellen, and I will let you hear it in her own words. Mary Ellen Goldberg is a licensed veterinary technician with a remarkable career spanning nearly 5 decades. She has more letters behind her name than I could ever hope to have, including bachelor's, certified veterinary technician, licensed veterinary technician, certified veterinary pain practitioner, and veterinary technician specialist in several specialties. I could go on and on. A graduate of both Harcum College and the University of Pennsylvania, her experience stretches across small animal, equine, and mixed practice, as well as zoo and laboratory animal medicine. She's also contributed to pharmaceutical research and advised researchers on anesthesia and pain protocols at Virginia Commonwealth University. Though retired from clinical practice, she continues to teach anesthesia and pain management through VetMed Team. Mary Ellen was named NAVTA's Veterinary Technician of the Year in 2017 and has authored and contributed to numerous texts in the field. She had so much good stuff to say. Let's go ahead and get into it.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Well, I'm excited. Mary Ellen Goldberg, thank you for joining me today. I'm really excited to jump into talking about evaluating pain and really trying to manage it effectively. And you are certainly somewhat of an authority in this area. So thank you so much for joining me.
Thank you for having me very much, Dr. Cassi. I'm happy to be here and love talking about various ways to help pain, no matter what kind of pain it is.
Absolutely. And I love that we started off there as far as various different ways to really manage this, because it was actually just yesterday evening. I was sitting on the floor of the hospital typing in medical notes on my laptop next to my dog, who was full of acupuncture needles. And it was after hours, so someone from the cleaning crew was there and asked me about it. And I said, I do think this is an area where in veterinary medicine, we are a little bit ahead of the curve in some ways with multimodal pain management.
Yes.
So we have so many options, and I think we need to continue to talk about them often and keep remembering how many options we really do have to benefit our patients.
And I will tell you, Dr. Cassi, I find that in human medicine, in pain management, I've been studying it, involved with it since easily early 2000s and prior to that. And I will tell you that in human medicine, they do not generally talk about multimodal management
Mm-hmm.
because we go to opioids, we go to some NSAIDs. That's it. They don't, everything such as what you just mentioned, acupuncture or chiropractic or physical rehab, nutritional pain management, any of that kind of stuff was looked at as kind of woo-woo. I mean,
Right.
they just didn't do it. And so I think we are ahead of the curve because in not being able to verbally talk back and forth with the patients, you need to try to read their body language, read their behaviors, and that helps develop things. We don't get the feedback, and we need to be the advocate for them.
Yeah, absolutely. And I think some of that along the lines of what you're saying, really needing to advocate for them and understanding their pain in a different way where it's not, well, is your pain better? Well, yeah, I think so. Instead, we have to watch them move. My lab, for example, he my boxer keeps running into him full force in the yard and he has what I suspect is some IVDD in his neck and wasn't responding as well to NSAIDs. So we really went the multimodal route. And it was after we did a combination of acupuncture and Adequan that I saw a major difference in him. He started playing again. He caused some trouble, which he hadn't done in a long time. That I've never been so happy for my dog to get himself in trouble and do something he wasn't supposed to do because he felt better. So I think we can really observe those behaviors and get a good idea of what's happening and how well their pain is controlled. And continuing on with this example, we were really doing this for his neck. We did it once a week for a month and saw a big difference. But yesterday it was supposed to be a 2 week follow up, it was 3 weeks. And when he was getting this treatment, we found a new point in his lumbar spine where he had developed some sensitivity. And these are all things that we really have to be staying on top of our patients and paying attention to pick up on. And they open the door for so many opportunities to really improve quality of life.
Absolutely. And think of what you said. You said acupuncture and Adequan. And both of those modalities, I realize Adequan is an injection. However, both of those are not on like the primary list of drugs, that you could talk about and you could say, well, this is what I do. However, how old is your lab?
He's going to be 5 this year.
Okay. But, so many times people just automatically jump over acupuncture, not necessarily Adequan, but with acupuncture, they just jump over it because, well, don't you have a pill? Can I give a pill? It's a whole lot easier to just shove a pill in.
Sure.
Do you see what I'm saying?
I
And
I do. And really that kind I was not dissimilar from that. I certainly started with carprofen and wasn't
yes,
getting as good of an effect I was hoping for with using oral pain medications. So I went to acupuncture. I've certainly recommended acupuncture for my patients in the past, but never seen it in my own animals. Now I am man, if I wasn't a believer before, which I think I was, I'm very much a believer now. It made a huge difference.
it is one of the primary modalities for geriatric animals that may be having kidney issues, liver issues, any systemic issues that you're concerned about medicine or something else where you can use acupuncture, and people are amazed that it has that big. But I mean, I like you, I've been a believer for years. And as I think I alluded to in talking to you previously, Dr. Robin Downing told me of a case. We were at a meeting. She had a dachshund come in. It was IVDD, and the dog was paraplegic. It came in, could not walk, had been that, was screaming and yelling. She did one acupuncture session on it. The dog walked out of the office. Now that sounds like, oh, it's magic. The dog did have to come back, but it
Course,
wasn't
sure.
like, you get this one treatment and now I'm cured and I'm gone. The dog did have to come back. But if you see something that is that dramatic, and veterinary technicians or nurses cannot get certified in it, but I've been through two of the schools, Chi Institute and Curacore.
Sure.
Yeah, so I've been through the medical acupuncture for veterinary technicians, and I've been through TCVM, traditional Chinese veterinary medicine, up at the Chi Institute. The two technician programs, I've been through both of those. You get a certificate that you took the course, but you're not certified to practice. And what it basically allows you to do is understand what's going on and be of use to the veterinarian. I've been in practices where I was helping the veterinarian. I'm allowed to, at the end of the session, remove the needles.
Mm-hmm.
I'm allowed to sit with the owner and the patient. And if a needle needs to be turned so the stimulation can go through, I'm allowed to do that. I'm not allowed to place the needles. I'm not allowed to say, oh, this, the diagnose,
Diagnosis
prescribe,
and right.
and treat. And I'm allowed to do some things under the veterinary auspices. And when you're working with veterinarians it's a collaborative effort,
Right.
then it's not, well, you can't do that. Or I'm just the peon sitting in the room, taking up space. You
Right.
work together to understand it. So it's gotten much, much better than it used to be years and years, because I've been around so long. It's
And here we are benefiting from all of your knowledge. And I love that you bring up the collaborative approach, because there is observation involved in really evaluating pain in our patients as opposed to being able to ask them. And when we collaborate, that's really where we get the best result for our patients in almost every case scenario. So I'm wondering if we can dive into that a little bit and talk about evaluation of pain and some important points of, why it's important to really get a good picture of pain in our patients, how to do that effectively, and then how we can collaborate as a team to really get the best answer and make the best plan.
Think of it this way, whether it's on a video and I love owners that will take videos of a patient, because pain behaviors can be very different at home than they are in the office, and so I love being able to watch a video, see how it is. Think of it this way. When I was at the University of Pennsylvania Veterinary School, and we were out at New Bolton Center for horses, and they would be doing lameness exams on the horses. And so someone would be trotting the horse by or holding the horse or whatever. And it can be the same way with owners, with their dogs and possibly with their cats. A lot of times you want to get them to move and see what they're doing. More than one set of eyes on an animal that's got pain, mobility issues, you may see something in an entirely different manner that I just missed. And it's like not seeing the quote, not seeing the forest for the trees. I may be so zoomed in on one area, I'm missing another. And that's where the collaboration can be. If I saw something, and I don't know that the veterinarian does, generally I wait till we go out of the room. I say, have you thought about using XYZ? And did you see that? So, you can do it in a tactful, kind manner that you're not stepping on each other's toes. When I teach, that's what I like to tell younger people, because they'll just want to blurt something out.
Well, it's
And
exciting when you see
yes,
something and you don't have a lot of experience. It's like, I see it. I see it. Do you see it?
and I like to say there are ways to present it. And with the technician or nurse, that's a big deal to let them learn. If you want the veterinarian to respect your opinion and to listen to you, you don't come in telling them you're wrong. This is what it is. You put it forth in a gentler manner. And maybe somebody would say, "Well, I disagree." Well, doctors can do that with each other, but when you are not the doctor or the researcher in charge of a project, you have to learn how to communicate in a kind manner. Uh, So, and that's the way you get them to respect you and listen to you.
You're the person they request, or you're the person that you develop a rapport between the two of you. And Mary Ellen, I really appreciate that insight because certainly from the doctor side of the table, I really think that goes both ways. That we need to be open to feedback and realize that we're fallible as well and we're capable of missing things and appreciate the opportunity to benefit from the knowledge and the insight of the people around us who might have a different experience. They've seen different things in their career. They're looking at this animal a little bit differently, and so we each might be picking up on different things. And it is that collaboration that really benefits our patient. And I think that respect needs to go both ways. I really appreciate the way that you put that because there is some degree of at the end of the day it's my license that is making
Oh,
that is
yes,
backing up the clinical decision here. So ultimately we have to make that final decision, but I think that coming from both sides can be very open to benefiting from each other's experience and each other's knowledge.
I worked at a huge medical research facility. I won't go into detail about all the species that I worked with, but dogs and cats were in there. And all I'm saying is, one of the things that the researchers would do is once they learned to trust me, people started calling me. They would say, "Will you please come look at my animals? I think I've got some animals that are having a problem." And I would go look at them. And I had a director, the head veterinarian. I had someone that would say to me, "Mary Ellen, I trust you completely. Go look at the animal. If you see something that you feel needs to be treated," because we had a clinic, we had a little veterinary area and hospital where the animals could be brought to and treated or anesthetized and things like that. He said, "Call me, tell me what you think should be done. If you want me to come and physically lay eyes on the animal, I will. If you feel confident in what you're looking at," he said, "you call me, tell me what you're going to do, make sure it's in the record so we have a record of it, and I'll be more than happy to allow you the leeway to do this." Well, that was a tremendous freeing and collaborative effort to allow me. If you're afraid to talk about something or admit something, even think about it, even if you're an owner. If you're like, "Well, they're going to look at me and say I'm not taking care of my pet. I don't want to talk about that, or I don't want to take this in because they're going to get me on a welfare." Do you see what I'm saying?
I do. And it's such an important point, remembering that there's fear on both sides, concern on both sides. Certainly from our point of view, like what if we mess up the diagnosis or, we miss something or we prescribe the wrong drug or the wrong dosage or something like that. But remembering that goes both ways. And I think we're continuing to circle back around to what's such an important point of this collaborative effort. And if you're up for it, I want to go even further down the collaboration road because I think there's so much to say here. And I'm wondering if we can talk about it in terms of the different modalities that we have available for pain management and how that plays into, kind of the role of the doctor and the technician and or nurse, the pet owner as well, because we've touched on oral pain medications, Adequan, acupuncture, ketamine is another one that's getting more and more attention here lately. And then certainly physical rehab and things like that. And all of those require different input from every member of this care team, including the pet owner.
Oh, absolutely. There's a course. It has been on VIN and VSPN for, I think this is the 11th year. And I am one of the faculty. Now, it's run by veterinarians on VIN. It's the core course for the certification from the International Veterinary Academy of Pain Management. Now, I'm not the primary lecturer. They have a whole bunch of lectures. They go through pathophysiology, they go through medications, they go through adjunctive medications, they go through acute pain, they go through chronic pain, they go through emergency and critical care pain, nutrition, rehabilitation. I mean, it's wonderful. So,
Good. Yeah, and all of it, I love like the pathophysiology and physical rehab part of it because I think those are such big components that sometimes get overlooked. And I know I was certainly in that boat, especially when it comes to physical rehab of saying, "Oh, well, I'm not, certified in rehabilitation. I'm not a certified veterinary pain practitioner or any of this." But when I dove into it a little bit more, it was amazing to me how many home exercises there were that were
yes,
just simple that owners could do. And I felt very comfortable recommending, talking about ramps or, can you have your dog sit and give you his or her paw and,
yes,
do shake to work those elbows or sit to stand and very simple things that could be done that owners could do at home and didn't feel scary and like we were having to get into this whole big ordeal with their pet.
another area that I love to talk about. So the the cat that I just mentioned, my cat's 14 now, and I just took him for his yearly checkup, and he's doing beautifully. But what we noticed was when the doctor, she was palpating him, and what she did was she extended his hips and she extended his shoulder. And when she did, he didn't like it. I know we're supposed to be talking about dogs, but 90% of cats, by the time they're what, 7 or 8 or 9, they have osteoarthritis or degenerative joint disease. So
Mm-hmm.
now he's 14. And so he does have muscle wasting in
Sure.
his rear end, around his hips and down, in his thighs and things like that. So we talked about Silencia, the monoclonal antibody drug that is out for cats. And I thought, well, what else could I do? I bought Myos. It's a supplement. It has fortetropin and glucosamine, chondroitin. It's got omega-3 fatty acids. So I can tell you that I bought a jar and I've started Jimmy on that, mixing it in with his food. And he's already on a food from Purina, a senior food. My point is, I wanted to try something that I could do other than just an injection every month.
Sure.
Because I also thought, what if you start it and you get an injection, and then being a senior person myself, and you run out and you're not working full time anymore, so you're not going to be able to afford. I didn't want to have him get something and then withdraw it
Right.
abruptly and then lose any progress that had been made. So, I mean, there are things out there and products that can be advised to people to use or to try, and then they can fit it into their budget.
Sure. You're really illustrating here the importance of those individualized treatment plans. And in what you're describing, certainly I've had great luck with Silencia and seen it make a huge difference in the lives of a lot of cats, but it's not right for everyone, whether that's, I'm out of town a lot, so I can't bring my cat in once a month, or it's a financial thing, or, this cat hates coming to the clinic and won't tolerate injections and is not a good candidate. Then there's so much more that we can do for these pets besides saying, okay, well, it's this or bust. We've developed so many more options. over time. And from the ingredients you listed, I mean, I'm familiar with all except for forte-tropin, but from what I understand, especially with omega fatty acids, there's a good bit of data backing
Oh,
up the
yes.
benefits of
Yes.
those when it comes to osteoarthritis.
I also think of things that can be done. You can send home a TENS unit and you can preset those things for the owners and they can take it home and use it on the animal or something else, an Assisi loop, massage, all of those things. Those aren't pharmaceuticals. And those are things that can be calming and relaxing and help with pain. And they can be used whether it's a baby or whether it's a geriatric, ancient, old animal. So, I think we are getting to where we're looking at a whole animal approach to helping with pain, not just give it a pill.
Absolutely. Especially if we're talking about, say we use the example of my lab in the beginning, being 5 years old, putting him on a pill for the rest of his life, whether it's effective or not, is a challenge. And certainly there's concern for cost, there's concern for side effects and inefficacy, tolerance and
Yes.
him, just not working well anymore. So supporting pain management from all kinds of different modalities, just I think when we do utilize those pills and that does become something that's very necessary, I think we help use them for what they're meant to be used for, and they it helps them stay effective to where we're really getting the benefit, and like you said, kind of watching out for the side effects and trying to mitigate those as much as possible.
And so let's use your dog as an example, 5-year-old. So let's say it needed to be on an NSAID. In dogs and cats now, there's clinical evidence that if they're on as a maintenance kind of drug, you get it down to the lowest effective dose. And then what you do is you keep it there so that it's not high levels. And you don't always need the highest level recommended dose for an animal. But when you start talking about chronic pain, you get it to the lowest possible dosage to keep them comfortable and to keep them, where they're functional. So I guess talking about functionality, there are ways to measure functionality, and those are clinical metrology instruments. For dogs, there's the Helsinki Chronic Pain Index, there's the Canine Brief Pain Inventory, and there's lots of data on these. There's the Cincinnati Orthopedic Disability Index, there's Vetmetrica Health-Related Quality of Life, Liverpool Osteoarthritis in Dogs, and Canine Osteoarthritis Staging Tool. And for cats, there's the Feline Musculoskeletal Pain Index, and there are other chronic pain tools for them also. But these generally are looking at, can the animal move well? What kind of quality of life does it have? There are questions to ask that the owner can answer. When you look objectively at one of these measuring instruments, then depending upon the score that you get, you can follow how quality of life is. So just as an acute pain scale can give you trends. So you've got an animal in the hospital, you're using an acute pain scale to follow how it looks, how it's doing. The trends lets you know, is the treatment working, no matter what the treatment is. Same thing with the chronic pain and these clinical metrology instruments. If you have cases that are important that you'd like to follow and see if they're improving, or before they even come in, if they could film their pet and then say, do you see this? This is not normal. A lot of times this can be extremely instructive to whoever is evaluating the animal.
I couldn't agree more. I do house calls, so I get the advantage of seeing pets in their home environment. But even still, I'm a new person who shows up. If I have anything to say about it when I show up, I'm the treat lady, not the poke you with needles
Yes,
lady. So, they're excited because there's a new person and I'm there just for them and I've brought treats and this is exciting. There are those that are, they get nervous. They're like, oh, I know you're here to poke me and like make me stand on that weird scale that makes my nails make funny sounds. But either extreme, they'll still hide their pain sometimes, even in their home environment. And just recently, it was a patient who was limping, and I could see the head bob. Even though the excitement was there, I said, I see it. I recognize that there's lameness here. But of course, I'm extending and flexing everything. And you're like, you're petting me. This is so great. And there's, no pain is being elicited. And it's hard to feel crepidous because every time I
yes,
get into one position where, a dog's dancing in another position. And finally, this dog started kind of going back and forth across the house. Maybe I think we were throwing a toy or something. And then I could see the head bob more clearly. So I pulled out my phone, put it in slow motion mode, and took a video. And like, bingo, there it was. We could see it perfectly, exactly what leg the problem was, and know that that's the one we need to palpate more thoroughly. So,
yes.
yeah, I mean, a picture's worth 1,000 words. How much is a video worth? It's a major necessary tool in these evaluations.
That's wonderful.
Oh, we have fun. And I want to say that was an acute one, but I'm wondering along those lines when we're talking about these objective measurements of pain, like COAST and the Helsinki pain index and all of these, because in I guess in particular cats, but dogs as well, because they will kind of hide this pain, especially chronic pain, when they come into the clinic or they're in any sort of new situation. Can we talk to the owners about how to do these types of evaluations at
Absolutely.
home? Okay.
Absolutely. They can be given to the owner. It can be explained to the owner ahead of time. Just because the animal leaves the hospital doesn't mean that all pain that it has to stop and is negated.
Hmm.
You can show them how to look at pain, how to search, because a lot of owners, they have no idea what they're looking at. They just think
Right.
my cat or dog has gone under the bed and is hiding, and that's not what they normally do. And if it's acute pain, it should be that as time goes on, the pain lessens because pain in the acute stage is healing and protective and should go away. If pain does not go away after 3 months, then it becomes a chronic issue. And that's when you have to start looking at, is it a disease process? Is it due to a nerve injury like a neuropathic pain? If it's something like that. But these things can be sent home with owners. And I just feel as if we can understand it, an owner can understand. I mean, I don't hesitate to want to educate the owner, educate the client, send things home with them. And I feel as if when they're educated, they can help us and it becomes collaborative between the owner and us.
Gosh, and we get such better information that way. And I love that it's collaborative but also objective.
Yes,
Because I think that can be really challenging to say, are they doing better? And if I wasn't a veterinarian and, kind of knew what to look for in my own dogs and what I was treating, I have two kids, they're young, they're in school, I'm running around like crazy. And you're asking me, is my dog doing better? I'm like, I think so. It's probably better, especially when we're talking about chronic pain, not something acute that is going to rapidly worsen and rapidly improve. If it's something that's kind of a slow change over time, that's a lot harder to pick
yes.
up on and reflect on and say, is it getting better? Is it not getting better? So, having objective measurements that we can use to evaluate, particularly chronic pain in animals, and then having the owners involved in that too, to the extent that they're able, and giving us not just a gut feeling and opinion on if they're feeling better and if our modality is working, but actually an objective measure of yes or no, we're seeing improvement, I think can really be useful in guiding our treatment decisions.
Documentation is everything. And believe it or not, it is in veterinary practice also. So that is why things like, are you using a pain scale? And whether it's a veterinary hospital or a facility inspection or anything, they want documentation. So if you have some paper, well, see the trend here? It got better as we went on with this treatment, and especially in facilities when you can say, well, yes, we're doing this. Look, the researcher is, we're following pain management all the way along. Those kinds of things can be very, very important. People may think, well, it's just more paperwork. I hate it. I don't want to have to do it. But sometimes legally down, it can be if you've got a client that's angry, and when you can show, well, this is what we did, this is how we did it, we were watching out for this. I don't mean to say that all owners are looking for something to blame somebody for, but a lot of times losing their pet is so hard, and they just think they didn't do enough.
We
They
should have done
just didn't do
more.
enough. Do you see what I'm
I
getting at?
I do, and kind of on the contrary there, the opposite scenario, we talked a little bit before about costs and things like that. Certainly, I think, to go on a little bit of a different tangent here, we're seeing a little bit of an evolution in veterinary medicine where much of our revenue is now having to center on service-based items and, not necessarily products. And if we're going to charge for those services, I think it's also important that the owner has a positive perception of the service that they're getting, of
Yes,
what they're paying for.
yes,
And I think when we have that documentation and we can show, here's all the things that we're doing, here's how your pet has objectively improved over time, here's what we're going to watch out for, and we can really kind of lay it out there and show the owners this is why we charge for this service, and this is what you're getting out of the time that you're investing, the money you're investing. Then it really, I think it paints a really positive picture of what it is that we're doing.
absolutely. Absolutely. You could go on for hours about that topic
Yes.
because it's so different in veterinary medicine versus human medicine. People don't think twice about, okay, well, this is what it is. And to a large extent, now that we're getting more to pet insurances
Hmm.
and people are insuring their pet, it's helpful. But I'm the prime example, basically retired, working a part time. And so I have to watch out financially what I'm doing. You have to make choices about where you're going to spend everything. I feel bad with in talking about my cat. It may get to the point where he needs to have an injection, and that will be then become a priority, and you can budget for it. I mean, he is, now you can laugh at me. He is only 14. I want him around till he's 25.
Absolutely. Absolutely. I know it kills me when we see cats really starting to struggle at, 13, 12, especially like 12, 13 years old. I'm like, no, it's not time yet. There's so much more we could
Yes,
do.
yes. Care, it doesn't have to be something that you let go. You can do it all their life. You can be
Right.
following it and providing the care. And that's a big, big issue now. They say looking for pain is the fourth vital sign for animals. There's temperature, pulse, respiration, pain, and fifth is nutrition.
Nutrition.
So we recommend you start looking for pain as a puppy. And that first visit when they come in for vaccinations and wellness, every single year, one of the things they get evaluated for is pain. So that it doesn't have to be something that all of a sudden it's this big surprise. Now, I don't want to say you lead clients on with questions, but if you're evaluating pain from cradle to grave,
Sure.
then if an animal came in, it was fine, it was fine, it was fine, it was fine. Now it's got a temperature of 103 or 104. Why?
Mm-hmm.
You'd want to explore that. So in the same token, it was fine, it was fine, it was fine, it was fine. Now I can't move his leg as well. Why?
Sure. And I think you bring up a really important point here because we talk about this a lot in different clinical areas about how important it is to be routinely evaluating. And in reality, there's so many things that we need to be routinely talking to owners about and evaluating for. And of course, time in the exam room is precious. Owners' attention spans are only going to go so long because they have other priorities.
Yes,
But I think when you're doing kind of like you've proposed to say, we're evaluating pain from the very beginning, and that's just part of our
yes,
exam and explaining to the owner, well, we're using this tool to evaluate for pain. Then when they do start to notice something,
absolutely.
we've sort of planted that seed. Sort of like a dachshund that comes in and as a puppy and you say, okay, these teeth are beautiful right now. We want to keep them that way, but they're very prone to dental disease. So we're going to watch this and planting the seed along the way that this is something that's important. This is something we're on the lookout for. Then when it does become an issue and we're talking about it more in depth, the owners know what to look for. So probably they're more apt to bring it up. And it's not such a shock when we're going, hey, maybe we need to start talking about fish oil. Maybe we need to start, doing whatever it may be to help manage the pain in this animal.
My daughter-in-law sent me a video. They have a French bulldog. He's 3. The dog's name is Bodie. She said, Bodie has just been laying around quivering. And I said, I honestly think you need to take him in because we don't know what happened. Well, as it turns out, it was pain. And they go to work every day and the children are gone and they think he jumped off of something
Mm-hmm.
and that the shaking was from pain. But my point is, in looking at the video, I didn't want to just say to her, oh, well, don't worry about this, because if it's a toxicity issue, you got to get on it right
It
away.
just gives you that extra layer of information because they may look totally different when they walk in the door of the
Well,
clinic
that's
than they
right.
did at home. And that happened to a friend of mine where we were having a hard time seeing the behavior she was describing. And at one point she ended up at an emergency clinic and said, this is what's going on with this, very stoic, also a Frenchie, who was, just like, I'm fine. Now that he's in a clinic setting. And so I remember she told me, she said, this doctor didn't believe me that this was happening. And she's like, and I get it because he was acting totally normal at that point. And she pulled out the video and said, this is what I'm seeing at home. Changed the whole dynamic. It was, oh, that actually is something serious. That is abnormal. He's just really stoic here. And they, changed their approach completely. So yeah, it's that added layer of information that we get from the video and understanding what their behavior at home looks like.
Absolutely.
Well, Mary Ellen, this has been just a fantastic presentation. Thank you so much for joining me. I have thoroughly enjoyed it.
Well, thank you, because I've loved listening to you also. I enjoy someone that's doing this and in a house call practice and what you see. I could listen to stuff like this forever. So
Ah,
thank you.
absolutely, absolutely. It's been so much fun. Mary Ellen, thank you so much for joining me. It was such a pleasure to get the opportunity to talk to you. Thank you to everyone out there who tuned in. I hope you enjoyed this conversation. If you did, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. If you'd like to hear more, click on the education tab on the VetFolio website. And of course, we'd love to hear your input on this talk as well as ideas for episodes you'd like to hear in the future. So feel free to email me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassi DVM, or you can find me on Instagram at dr.cassi.dvm. And remember, if one animal is better off because of you today, it's a great day.